we go for a meeting, this is a question we are always asked. I'm young and I feel healthy. Why should I care for a disease that's not going to hurt me in the next couple of decades, right? Because we know that, let's say, heart attack or a stroke comes around the age of 60s. Okay, 60s, right? But the point is, a couple of things. One, in India, we get this disease a decade, mind it, a decade earlier than the Westerners. So that brings us down to, let's say, from 60 to 50, right? Now, think for a moment. Why do a person get a heart attack or a stroke? The reason would be, we would say, maybe apart from being in the genes, you would have an diabetes, which is high blood sugar. You could have a high blood cholesterol or an elevated blood pressure, right? And that, after a decade or so, gives rise to that so-called attack. Now, pause for a moment. Think about it. One step behind. Why did this blood sugar, blood pressure, and cholesterol come in? They have come because a decade before all this again, the person is on a bad lifestyle.
But having said that, Tiny was giving a wonderful introduction of what happens if you have an unhealthy habit in terms of food intake. The junk food. What is junk food? What is fast food? Junk food and fast foods are not actually the same. Junk food is what you take very, very zero in nutritional value. But then it's a very high sugar, very high salt. And then as a result, you just keep, once in a way it's fine, but you just keep doing them on and on, every day in, day out. It puts on so much weight.
I feel sleep is the most important part in one's life because this gives a lot of relaxation. So what are the problems we are facing in this generation is either they won't sleep properly or they oversleep. Suppose they sleep at 9 o'clock and get up at 9 o'clock or go to sleep at 12 o'clock.
Correct.
And what we call it as there is social jet lag. See, jet lag, suppose like that, there is a social jet lag. Means they sleep up to 1 o'clock in the night, weekend, so Saturday or Sunday weekend. They sleep late and get up in the next day is a Monday. And next day is a Monday. They have to work. Immediately they get up early.
Symptoms of heart disease in women are entirely different as compared to men. The chest heaviness or angina, as we call it, is not commonly present. The common symptom is shortness of breath. So shortness of breath, uneasiness, some sweating, these are common symptoms. And these symptoms are often misdiagnosed and mislabeled as perimenopausal symptoms and other causes.
See, women, they are blessed as well as they are having a problem. It's like a two-edged weapon. Blessed because until menopause, they are protected by the hormone estrogen. So this estrogen actually protects the women from having a heart attack because of the vasodilator capacity in the vessel. So this is all protective effect. But at the same time, it gets neutralized when the patient has a diabetes or a strong family history or a stressful life.
Yes, stress is the new tobacco. That is the saying goes nowadays. Because nowadays the stress for both women and men, stress is becoming a very important risk factor for cardiac diseases, acute coronary syndrome and some arrhythmias. Those are life-threatening. So what happens is whenever there is a stress, that can be a physical stress, there can be an emotional stress as well, that will increase the heart rate, it will increase the sympathetic activity of our body. And this excessive sympathetic activity is the most important pathologic mechanism for most of the cardiac issues, acute coronary syndrome kind of things or arrhythmias that can cause sudden cardiac death. Like for example, a patient is already having some amount of block inside her heart, but when she gets stressed, then the sudden sympathetic overactivity will be there that will cause the plaque to rupture or to erosion of the plaque. So that is the precipitating factor that will give rise to acute coronary syndrome and heart attack. And so nowadays stress is so important that it is an independent risk factor for all kind of acute coronary syndrome and acute cardiac events. So two of them are most important. One just I have already discussed is acute coronary syndrome, plaque rupture and heart attack. And another is arrhythmias. Like if the patients are having sudden increase in the stress level or sympathetic overactivity, that can precipitate life-threatening arrhythmias like ventricular tachycardia, ventricular fibrillation, sometimes atrial fibrillation as well. So all those things are stress related. Stress is a very important thing. So and nowadays the problem is women, they are working more, even more than the men, because they're working outside, they are having their corporate life, now they are taking care of their kids, they are also working in their houses as well, so it's very stressful.
So there is a term that is known as the primordial prevention. The definition of this primordial prevention that we should actually stop the risk factor that is basically responsible for developing the heart disease. So I am just quoting a research or a journal in which it was published that the most of our children, school-going children, there was some studies in which it was found that the most of the school-going children, one out of 5 children, they consume more salty things, they consume more this fast food, and only 2 out of 5 children, they were asked about their food habits, they choose fruit and vegetables like things. And simultaneously they actually studied the cholesterol levels of some sort of groups of children in school. So the lipid profile of the school going children of 5 to 15 years of the age, surprisingly they are high. So we can actually think that the problem actually starts from the childhood.
The most important cause for missing a cardiac problem in today's world is not identifying it very early. And we tend to ignore these symptoms. These may be in the form of just light indigestion, some chest pain, which started slowly and subsided, again started increasing a lot. Typically, these cardiac pains are like central, retrosternal, behind the chest wall, squeezing tight, and they are usually associated with sweating and impending fear of death.
First of all, I will say that, okay, you have to have a good amount of sleep. We start from the night of the previous day. You have to have a good amount of sleep, almost 7 to 8 hours per day. In daily life, you have to manage stress. There are definitely different risk factors for cardiovascular disease, like established risk factors like diabetes, blood pressure or hypertension, then dyslipidemia or rise in cholesterol. But sometimes we ignore stress. Stress also is a very important risk factor which we should manage in daily life. So good amount of sleep, then stress-free, how to manage stress. We have to do yoga, we have to do pranayam, that can help us. And means we should have less expectation, means we should have a, we don't have to pump up ourselves very much in daily life itself. So next thing is, if we already have a diabetes, then we have to, or a hypertension or dyslipidemia, then we have to check with our doctors or caregivers so that we can achieve our targets.
And the first and foremost important thing is, after an heart attack, they have been prescribed with some new set of medications. They have to take all the medications properly. That means adherence to the medications is the number one thing. And second thing is, they have to monitor their heart attack symptoms, like warning symptoms, like chest pain or breathing difficulties or symptoms, because they would have been given a lot of medications which interfere their BP, heart rate and other things. So they may have light giddiness or some palpitation or anything. If they have more symptoms like that, they have to contact their primary consultant, and we have to intervene in a very proper time. And the third thing will be, they will think that they have to take bed rest for so long time, or they can go back to the job immediately or not. They can take rest, but it is not mandatory to be lying down in a bed or not doing any other work.
It's a fantastic question, because there's a misconception about cardiac rehabilitation. So for example, if I've got a patient who has had a heart attack in their 40s and 50s, and I say to them, can you attend cardiac rehab for a few sessions? They say, I'm absolutely fit, doctor, you fixed me, so I don't need to go get any cardiac rehab. Cardiac rehab is not only necessarily about exercise, but there are a lot of activities that do happen in cardiac rehab. Obviously, exercise is an important part, but more importantly, it has to be individualized. For example, I do have patients from the second decade. My youngest patient is about 22 to 90s. So their individual needs are entirely different. So what a 80-year-old man or a woman needs is entirely different to what a 50-year-old or 60-year-old man or a woman needs. So that is where individual cardiac rehabilitation does happen. The second most important part would be education. So there are a lot of doubts, and a couple of my colleagues, both of them have dealt many things about what are the things that happen after a heart attack. But more importantly, there's a lot of unanswered questions, minor doubts that the patients and the family, both of them will have. So that is an important place where they can obviously speak to our physiotherapist and get those smaller, minor doubts clarified.
So the compliance of medications, that is very much essential. First of all, we categorize them according to their need. So what is heart attack and how do we treat? We treat heart attack patients with either angioplasties or bypass surgery. So both of these procedures, after the procedure successfully done, we need at least antiplatelets, that means the blood thinners, to be taken for at least 12 months until untried contraindicated. That means suppose you are going for a major surgery, you are going for a glaucoma, you are going for a cataract surgery, you are going for a tooth extraction, then only you may stop for 2 to 3 days. Otherwise, you must continue your dual antiplatelet therapy for at least 12 months. That is must and mandatory. Second is your anti-lipid therapy. That means dyslipidemia, statins. You must take lifelong after your heart attack or brain stroke. And you should not reduce this dosage of your own. Many of our patients usually reduce the dosage, usually change according to their need. What you said that I am fine now. There is no term called fine after heart attack. You are always at risk.